Okay, it's my immense pleasure to introduce Dr. Anshu. She's Professor of Pathology at Mahatma Gandhi Institute of Medical Sciences, Sevagram, Wardha. She's an internal quality assessment coordinator at her institution. She was awarded a Commonwealth Fellowship. She's a Framer Fellow from Ludhiana and a Framer Fellow from Philadelphia. Next slide, please. Sorry, go back. Besides that, she's a faculty member and resource person for 4 Indian Framer Regional Institutes. And she is also a global faculty for Framer Institute at Philadelphia. She has edited a book on medical education along with Professor Tejinder Singh. She's a member of the self-study group and writing team of the first cycle of NAC and a former coordinator of IQAC and convener of the steering committee responsible for writing the self-study report in the second cycle. She's written online modules on assessment and accreditation for MHPE course run by Cayley University. It's a pleasure having Dr. Anshu with us. Over to Dr. Anshu. We look forward to hearing from you and your thoughts. Dr. Anshu, please.
Thank you so much, Dr. Avasti and Dr. Chaturvedi. Let me share my screen. Are my slides visible?
Yes, ma'am. You just have to make it full screen.
Is it done now?
Yes.
Yeah. So good afternoon, everybody. At the outset, let me thank the organizers for inviting me to speak at this interesting web conference here. And I've been asked to talk about curriculum enrichment in medical education. I'm not sure how many of you are familiar with this term, curriculum enrichment. So let me start my talk by giving you a definition, a formal definition of what curriculum enrichment is. I'll then go on to talk about the purpose of enriching the curriculum. And then let's discuss some strategies by which you can enrich the curriculum and some practical tips of how we can go about it. So first, what exactly do you mean by curriculum enrichment? When you talk of a formal definition, enrichment describes activities which educational institutes provide in order to extend students' education beyond their main course of study. So when you look at what we are doing in our colleges, we have what is written curriculum, and that written curriculum needs to be implemented in your institutions. Now, how you bring life to that curriculum, how you make it interesting for the students is what enriches a curriculum. And while doing it, we need to remember that we are preparing our medical students for the future. And we heard a lot about what the future is going to be. But the truth is, not any of us know what the future is going to be even 5 years from now. Still, we are going to prepare our students for the future. We have to prepare them so that they turn up being well-rounded personalities. We have to look both at their personal development and at their professional development. So what activities can we undertake in our institutions to make something which looks dry on paper, the curriculum, the medical curriculum and the content, come alive and become more interesting for everybody? So if you look at the NAC guidelines and what it talks about when it says, when it discusses curriculum enrichment, it says that the holistic development of students is the main purpose of the curriculum, and health education institutions are expected to have provision for courses and activities which may not be directly linked with one's discipline of study, but they should contribute to sensitizing students to cross-cutting issues relevant to the current pressing concerns, both nationally and internationally. And then they've given examples such as gender, environment, sustainability, human values and professional ethics, development of creative and divergent competencies. So as is clear from this, NAC is looking at how you facilitate the development of a holistic personality of your students by getting them involved in all the societal changes around them, which may be happening nationally, regionally, or internationally. Um, and this is done by providing a wide range of value-added courses. And here, these courses are not mandatory, but these can be chosen by students according to their interests and inclinations. Um, Now, we are preparing students for the 20th, the future. Uh, Now, what you need to remember here is that we are preparing them for what are called the 21st century skills. So even the new education policy, the latest one, NEP says 2020 says that, and it says that we are to prepare our students, we need to provide them life skills. Now, life skills include a lot of other qualities, but two important ones are flexibility and resilience. How does a student know how to get up once they have, where once they're once they fall down? You also have to look at learning and innovation. We have to focus on making them self-directed learners because we are not going to be there for them a few years after they graduate. And they need to keep abreast with whatever is the latest. Do they have the capacity to search things for themselves, to know what is right and what is not right? They need to be self-motivated. They need to be creative. And these are skills that medical students unfortunately lose out under the burden of the huge curriculum. So these, if you look at engineering students, they are always asked to be creative. Medical students, if somebody goes into something like theater, dance, music, and you will tell them that, don't you have time to focus on your studies? Why are you going to something co-curricular? So we almost kill their hobbies, and it's hard to find students who are motivated enough to keep that creativity, that spark of creativity alive in them. The other skills that students need, and we heard a lot about that from Dr. Devi Shetty this morning, is work skills. And if the world of medicine is going to change, are our students prepared? Do they have ICT literacy and ICT capabilities? So in our curriculum, are we giving them those skills? Can they analyze things? Can they predict things? What is their productivity going to be when they become part of the workforce? Do they have leadership skills? Do they have team? Can they be good members of a team? The other skills required are interpersonal skills, which we cannot talk enough about because we need them to have good communication skills. They need to be good at collaboration because all of medicine is about collaboration, even though if you look at it, the kind of competitiveness that we force them into, people end up being cruel, competitive, and isolated consultants. So it's completely contradictory to what we want them to do in the workplace. And the way you push them through a highly competitive branch called medicine, we teach them to be very isolated people. Social skills, which includes being socially aware, socially conscious, and socially responsive, that is important, and how they can adapt to different circumstances. These are all important skills which can be taught, which should not be neglected. And of course, problem solving skills, which include critical thinking and analytical skills. So where in the curriculum are we talking about all of these? And if we are not, and if they are there, though, if they are so important, how can we include them in our institutions? So what is the purpose of enriching the curriculum? As I said before, the curriculum, which looks lifeless, needs to be brought to life by enriching the educational environment through well-designed transformative experiences for learners. And while we are complaining about attendance and why students do not come and attend our classes, we have to remember that when we deliver the curriculum, it has to be an enjoyable experience for the students. We need to have high student engagement. We need to see that students are enthusiastic about learning something new. And how we are going to create this is important, because literature shows that when all these things happen, students are better motivated, they show higher achievement scores, and we are able to retain them better. So there can be several purposes of curriculum enrichment, and I have classified them into these 5 broad categories. They are overlapping categories. First is introspection. Teach the medical student to uh, think about themselves, inform, and we do this by giving them, allowing them to have a personal development course. We provide them life skills. They need to know the value of metacognition, whether they are able to manage time, whether they know where they stand, whether they're able to do a proper self-assessment of themselves, whether they're able to reflect on their own learning, all of that. Resilience, whether they're able to work in teams. If there is a conflict, which usually happens, are they able to manage it? How well do they collaborate? The second aspect is inquiry. You teach them to be eager, curious learners. And we need to make them critical thinkers, let them ask questions, uh, be good at clinical reasoning, and also provide them the basic research skills and analytical skills. One important thing which we should not forget is inclusiveness. And that is where teaching medical humanities comes into the picture. We need to talk about gender, gender diversity, cultural competence, disability issues, socio-cultural issues. And you can use a number of methods. One popular one going around these days is the theater of the oppressed. You can also have many formats which can be used to run this module. As I said before, medical students also can be innovative. I think they know more about ICT than we do. So if you probably give them a nudge and allow them the freedom, they will be creative. I know students who have made actually applications, apps, which help in health education, which help in doing surveys. So there is a lot of lateral thinking involved in, I think, just encouraging students to do their own thing and not having too much control over them. They can do a lot of things much beyond our expectations. Keep your expectations of students very high. And then providing them insights into what lies ahead after college to them, insight into what the profession is. So in terms of career guidance, getting them to interact with experts, letting them to visit corporate hospitals or primary health centers, or community visits, industry visits, giving them short internships. So all of these are ways in which you can enrich the curriculum and actually make the student enjoy the process of learning, rather than sitting in a dry, boring lecture hall and expecting them to pay attention to something when they are free to learn this from YouTube. There's nothing wrong with learning from YouTube, but give them authentic learning experience where they actually have a hands-on experience of touching patients, talking to them, learning how to counsel them, learning how to take histories. So give them authentic experiences where the textbook comes to life. So I'm giving you some examples, and there can be, this list is endless. We can have value-added courses on gender diversity, cultural competence and societal responsibility, human values, dignity, ethics, and professionalism, about emerging demographic changes, about the geriatric population, about pediatric population, social determinants of health, environmental sustainability, critical thinking, creativity, innovation, the right to health issues, people who are not able to access healthcare, what can be done about them. Get them to basically think out of the box. We already talked about this: career guidance, life skills, internships, community postings, research projects, and preferably get these research projects done not just individually, but also give them group assignments, because that is where they learn how to work in teams. So project-based learning is a fantastic way of adding excitement into the lives of the students. So what are the strategies to enrich the curriculum? There is this enrichment triad model, which is given by Renzulli and Reyes. And they say that there could be 3 different types of activities. The The first is general exploratory activities, which are for all students. So maybe you want, like when students come to you for the first time in the foundation course, you could have experts, like I'm from the Mahatma Gandhi Institute of Medical Sciences in Sevagram, and we have a Gandhian philosophy. So at that time, when the students are just raw, they are malleable, we call Gandhian philosophers and thinkers to come and talk to them. And they talk to them about the importance of the profession, the ethical aspects of it, and they leave indelible marks on the minds of students. So these kind of exploratory activities of what a doctor is supposed to be and what the different kinds of ethical issues they come across, or simply taking them into the community, showing them actually how rural India is. These are all things which can be enrichment activities, which you can all design in your institute. The second aspect is what will students do in groups. This again can be used for the entire batch together. So you can use whether you want to show them how any one aspect of hygiene in a village, probably, or how a vaccination drive is taken, or how health education can be carried out in schools, or collecting data about diet. They're doing a diet survey on nutrition, gathering data, analyzing data, teaching them how to use that health information and create new programs. So these are all different things that you can do. You can even have them do small research projects depending upon what they have seen in the community. And the last one could be either an individual project or a small group activity. And these could be open to students who are interested in it. So these could be investigation of real life problems. Now, we are in a world where not everything needs to be done on the field. We have a digital platform as well. So some of these courses can be developed as modules on your digital networks and open to the students. Whenever they have time, they can go in and do some work on it. Maybe they have an assignment to submit and they'll probably get a certificate out of it. So this is completely open to your creativity and how you want to design it depending upon your medical school. You can have your own module, and what works for you in your school might not work in another school. So you not copy what somebody else has done, but do your own thing. So what exactly is curriculum enrichment? It has to be something which is planned and purposeful. When you do something, there has to be written objectives saying what you are going to do. They have to be responsive to students' needs and situations. If you find that students are stressed, maybe you need a program or a counseling session with them, or stress management session, you'll probably need to do that. If you feel students need to learn more about computers or statistical tools, maybe you'll do that. If you feel that they need mentoring, you'll probably have a mentoring program. So these groups these programs will be depending upon what you need, and also depending upon what your employers or other stakeholders need. So if your corporate hospitals or if your NGOs tell you that your students who come to us are weak in certain areas and we need them to probably develop more teamwork, so you will probably design a module which has all of these teachings in it in a different, interesting, interactive format. These groups have to be flexible. If students wish to enter, they will enter. Like if you look at IITs, they have these societies which either not only just going for debates, but they have people doing social service. There are people who are inventing machines. I don't see why that kind of society or group cannot be created in medical schools and actually get them to develop some outcomes and showcase them. So students have a lot of, they should have a lot of choices for them. And all of this must be related to the content. So what they're studying in the textbooks, that can be, you can increase the depth of it, the breadth of it, or the complexity of it. Sometimes some of these can be independent activities, sometimes they could be direct teaching. And this has to be across disciplines, cross curricular, and even cross disciplinary which the NEP talks about. So you can get students, the nursing students and the medical students to mix. You can get engineering students and medical students to get together and develop apps. There's a lot you can do. And this is not just more homework or more work, but it is a differentiated work which will allow them to explore a subject in depth. And this requires high level thinking skills to be applied. What curriculum enrichment is not, don't use these projects to say that just only the talented students will come in and anybody who does this is a gifted student or enrichment. No, you don't discriminate between students. It is a voluntary thing which students can come in. Just giving them assignments or tests is not curriculum enrichment or not extra homework. So you have to not, it's not just giving free time and expecting that they will do everything. It has to be a structured program which has objectives, which has outcomes, and you're following it up and monitoring the program. And then if certain outcomes are achieved, only then you certify that the student has done this course. So the practical tips for curriculum enrichment, always, it has to be a purposeful activity, focused and planned. Before you start, ask yourself, why are you doing this? What outcomes do you expect to see this as a result of this enrichment? And which is the specific content in your curriculum which is boring, which can be enriched? So maybe you want to talk about side effects of drugs. So if you think teaching it from a textbook is boring, can they go to the wards and look at patients who have had side effects? And can they come back and see what the reactions have been, the drug reactions have been? So can they write a paper on it? So you will have to think out of the box, and you decide that who is going to be involved in this and what choices will a student have. Will all students come in, or what are we going to do with this? So the NAC requirement for the universities out of the curriculum curricular aspects, the first criteria has 150 marks, and curriculum enrichment is a key indicator in 1.3 where you have 40 marks. For health sciences colleges, you have out of the 80 marks for curricular aspects, the 25 marks for curriculum enrichment. So what you will have to submit to NAC is a value added course. It could be spirituality also. There have been courses like Vihasa, which is conducted by the MUHS. Now, NAC specifies that just one guest lecture or one talk will not be taken as a value added course. To call something a course, you must have at least 15 or more contact hours. So your module, whether it is humanities, whether it is professional development, you have to show the curriculum of that value added course with more than 15 hours. And how many times is the course open to offer during the specific year? And how many students have completed that course? And then they work it out through this formula. And you have to give them information and evidence that you have actually done it. Like, for example, in our institute, we have developed a course on developing study skills. So every student in the first year or second year goes through this course, but we keep it open because we can take only 25 or 30 students per course. So the course opens twice a year. And if students are interested, and if they ask for more courses, we give them more courses. So you have courses which work for your students, and depending on your needs, we need to develop these courses. So when you write to NAC and prepare your reports, you will always think about the title of the course, the objectives. Why did you think of it? What was the context? What was the need for developing this course? And what do you do in this practice? If somebody has to replicate your project, what are the resources that you require? How do you know that this project has worked well? What are the outcomes you looked at? What happened? Did you encounter any problems? How did you handle them? So this entire thing, if you can write, and this you can write only if you have done something like that. So design a course which is unique to your setting rather than copying somebody else's program. I just wanted to show you some examples of what we do in Sevagram. Of course, there's a lot we can share, but because I have limited time. We have a village adoption scheme where every new batch of students, they adopt a village in Wardha district. What we do is every student is allotted 3 to 5 families, And somewhere in the first year, immediately after they join, after the foundation course, they spend 15 days in their adopted village. Now we have a good linkage between the institution and the community. So the community members there, they give us the space where the students can be hosted. Usually it's a primary school. We build a toilet usually for the students, and that the later becomes the part of the school's uh, property. And then they stay in the village for 15 days, and we send the students out into the community. Now, the objectives of this project is to orient medical students to rural life, because most of them come from urban areas, and this is probably the first time they actually visit a village. And there, every day has a different activity where we sensitize them towards environmental sanitation, the socioeconomic conditions, the health problems of the individual, the family, and the community in the area. So these students all collect data from their villages. We teach them IT skills because we use a Moodle-based platform. And on that platform, every student enters the data that they collected from their families. Now, this is also providing them early clinical exposure. We promote basic leadership. They learn how to talk to patients. That's the first exposure there. And if students have a language issue, actually students themselves have created a glossary where there is a Marathi to English translation or a Marathi to Hindi translation, and vice versa. So you have students coming in from all parts of the country, and some of them don't know Marathi. So there's a clinical dictionary which the students have developed. So this is our objective, and this is how we work on it. Now, once we have the entire village's information on that one Excel sheet produced in Moodle, the students are taught how to analyze it. Now, this we take it further, and we use it for undergraduate research, where students decide themselves what are the important areas to research upon. We divide them into groups of 6 to 10, where each group has a facilitator or a faculty. And when they go back and conduct short research projects in groups, which, if required, is funded by the institute. Some of these projects go in to ICMR, STS, but even if the students do not get funding, all the students who do not get funding are given funding by the institute. They have specific undergraduate promotion, research promotion schemes for them. So these are two different projects, but they're linked to each other. So I talked about it together. We also have a very robust bioethics wing, which is very responsive to societal issues. And I just picked up 6 because it fitted on this slide, but they do a lot more than this. This Diwali, they had a green initiative where they planted trees instead of bursting crackers. They tried to remove the stigma surrounding menstrual hygiene by doing the Red Dot campaign and talking to people about it. They have this anti-tobacco campaign, which I'm very proud of. They call themselves the White Coat Army. Now, these are undergraduate students who have been trained by one of the psychologists and the psychiatrists about how to talk to people and about de-addiction. Now, the program is run up so well that the senior students now train the junior students, and every evening the training is done. So a student cannot enter the program without training. They first observe and then they enter the counseling sessions. What they first started off was by going to the wards, and all the patient relatives who used to be sitting around, they started talking to them, talked to them about smoking and alcoholism, and then started these sessions about de-addiction. So this is the same campaign went ahead in the community where they're doing the role play here and teaching even young children, and their you can see the excitement in the campaign there. They have gone to schools and taught girls about good touch and bad touch. They visit orphanages, they collect donations from all of us. And in the anatomy department, they have a body donation campaign. They talk to the community about how they can donate their bodies after death. So you can see a lot of civic responsibility comes in through these campaigns. So there are just a few examples, and I'd like to end by saying that there is no limit to your creativity. It's important to empower learners by enriching the educational environment. Thank you very much, and I'll be glad to answer any questions.
Thank you very much, Dr. Anshu, for a very enriching and enlightening talk on curriculum enrichment. Literally, you have not only brought life to the curriculum, but you've brought life to the series of lectures which are going in. And as you are saying, this is to bring about a transformative experience to the learning by giving value-added courses. And very nicely, you told about the courses you all are doing in Sevagram and Varta. I liked your 5I concept for the purpose of transformation, the introspection, inquiry, inclusiveness, innovation, and insight. That was something perhaps you have created. That was very nice. That was your innovation, another I to that. So with these, the number of questions which, there's one question which I saw, and this question was by a person who wants to know that if you introduce a course, a new course, would you need approval from the ethics committee? Now, that was a question which one person has written in the chat box.
Now, value-added courses are something you do at the institutional level. You do not require any university approval or anything for this, because this is a local thing you are doing. It's not a certificate course that will require university validation and approval from the academic council. These are just little things that you do as innovations in your enrich the curriculum. These do not require approval.
Okay. So other than that, if there are any other questions, perhaps they'll put it in the chat box and they will, you can answer them. Another query by one of the audience was that if people could make their PowerPoints available, they've written to the organizers, and if it's open for sharing, that would be nice. So over to the organizers. Thank you, Dr. Anshu.
Thank you so much.
Glad hearing you.
Yeah, thank you.
I have one question, Dr. Anshu.
Yeah.
Yeah, ma'am. In medical curriculum, when we talk about these extra times, involving them in some other non-curricular activities, they're happy to join in, but they don't get any credit for that, and we don't ever show them in their results also. Like many students tell us that, ma'am, there is so much to study if we don't find for these things, even sports or like other cultural activities, and the other also. And they say that, ma'am, we don't get any credit for them. So is there any answer for that from your side?
One, I think I saw a question in the chat box as well. So these are certificates which the institution can give themselves. You don't need an outside agency to give certificates. Secondly, every student can have their own portfolios and write reflections about how they participated in these things. This will add to their CV. I don't see why they should not be part of, not give credit, because this is part of an all-round development which will always work in handy. If you have done some extra research or social work, that will always be a value. If you're applying anywhere, it will show your teamwork skills and leadership skills. So how you design the program is important. And yes, please do not do the same thing in theory and then do the same thing in practice. So you don't need to repeat the same thing. If they have learned the thing on the job, you don't need to have another lecture for it, do you? So cut down the time doing that kind of.
Thank you, ma'am. Thank you so much.
And there's another question, that do you send your students to the same family year on?
Yes, they follow the families up to the next 4.5 years. And every time there is an introductory lecture or a discussion which happens before that, and the topic changes depending upon the senior, the level of the learner there. So they follow up these patients, actually the community, and they have very strong bonds. In fact, when they come back for their Silver Jubilee celebrations 25 years later, they first visit their families and then they come to us. That village visit is mandatory in our place, because I think they even celebrate birthdays of their family members. They call them the adopted families. Yeah. So
thank you, ma'am. That was a very enriching lecture, I should say, and an eye-opener to a lot of us who are not actively involved, I'm sure, in the NAC accreditation process. So this is something actually new to those who are not actively involved in the accreditation process.
Thank you, Shalini.
I would now request Professor Arun Chaturvedi sir